to Medwin Dr. Andrews Academy. I welcome you all for OMAN Crash Course 1. Pharmaceutical Science. We'll start with general pharmacology. First, we'll look about carrier-mediated absorption process. So what is carrier-mediated absorption process? You all know what a carrier is. It's something that binds reversibly or non-covalently with a solute molecule to be transported. This carrier-solute complex travels across the membrane to the other side. So you all know not everyone can cross the cell membrane, right? Sometimes they need some support. That is the carriers. They are like proteins, and these substances that cannot cross will bind to these carriers either reversibly or non-covalently with a solute molecule that is to be transported. So we'll make a carrier-solute complex, okay, C and S complex, and this complex is the one that travels across the membrane to the other side. Let's look about the important characteristics of carrier-mediated transports. 1. A carrier-mediated or a carrier protein always has an uncharged, or it will be non-polar in nature, and its outer surface will be uncharged, which allows it to be soluble within the lipid of the membrane. Okay, so you all know only lipophilic substance can cross the cell membrane, right? So in order to make this carrier surface lipid soluble, it has no charge, or it is non-polar in nature. Next is the carriers have no directionality. Okay, it doesn't mean that, so it means that the carrier does not only go from one side to the other side. It does not have a particular direction. They can work efficiently in both or in different directions. The system is structure specific. Drugs having structures similar to essential nutrients called as false nutrients are absorbed by the same carrier system like 5-fluorouracil or 5-bromouracil. So it means that the carriers don't just carry anyone that comes and binds with them. Okay, it needs to have a specific structure. So these solute molecules will mimic the structure of the essential nutrients. So essential nutrients can combine easily with these carrier proteins, and they can cross the membrane. So when you give a substance, okay, that substance should have the similar structure of the essential nutrients, so that the carrier proteins will not recognize it's a different substance. It'll mimic, okay, think that it's the essential nutrient. That's why we call it as false nutrients. Okay, so one such example is 5-fluorouracil. It's cancer drug that we usually give. Next is, as the number of carrier is limited, the transport system is subject to competition between agents having similar structure. So this is a limited system, okay? The carrier number is limited. It is not that, in your body you'll have n number of carriers. The number of carriers are limited. Because the number of carrier is limited, the transport system is subject to competition, okay? One component will compete with the other to bind with the carrier molecule. So there will be a competition between them, and this is especially between the agents with a similar structure. Since the number of carrier is limited, the system becomes saturated. So what is saturation? Okay, so if you have 10 number of carriers and you have 10 number of substance to bind with the carriers, that will bind. Okay, but if you have 10 carriers and you'll have 15 solute molecules to bind with it, what happens? Only 10 will bind, and then the structure becomes saturated. No more solute molecules can bind with the carrier because there's no carrier left. That's when we say it is saturated. In case of carrier-mediated process, the drug absorption increases linearly with the concentration until the carrier becomes saturated, after which it becomes constant. So in case of carrier-mediated process, the drug absorption increases linearly with concentration until the carrier becomes saturated, after which it becomes constant. So when you take a graph of carrier-mediated process, you'll have the drug absorption going up linearly. Okay, it goes in this direction. And it keeps increasing until the carrier becomes saturated. That is, when the carrier number of carrier is done, or the number of carrier is completed, we say that the system is saturated. Okay, that's when it becomes constant. It'll have a straight line like this. Such a capacity limited process can be adequately described by mixed order kinetics, which is also known as Michaelis-Menten saturation or nonlinear kinetics. So this particular graph or this process is also known as capacity limited process because the carrier number is limited. It will attain saturation once the carrier number is over, and that's why we call it as capacity limited process. It's also represented by mixed order kinetics. So we have zero order kinetics, we have first order kinetics, and we have mixed order kinetics, and this is also known by the name Michaelis-Menten saturation or non-linear kinetics. If it's linear, it would only go up, okay? Since it's going up, and after the process gets saturated, it becomes constant, and the graph turns like this. That's why it's not linear. There are two types of diffusion: facilitated diffusion and active transport. So from the name itself, facilitated diffusion means it has got its own facility and it does not require any additional energy. Okay, the driving force is concentration gradient. From higher concentration to lower concentration, it does not require so much energy, it just keeps going on the flow. Whereas active transport, active means there's some kind of activity going, and for that you need some kind of energy. So a transport that requires energy in the form of ATP is known as active transport. Moving on, we'll look into what Lipinsky rule is. So what is Lipinsky rule? It's also known as Lipinsky rule of 5 or 5 rules of Lipinsky. Okay, so we'll just break down the 5 rules. First, we're talking about the 5 hydrogen bond donors, then the 10 hydrogen bond acceptors, then we have molecular weight and partition coefficient. Okay, so according to the Lipinsky, so this Lipinsky rule is mainly for knowing the absorption of the drug, oral absorption of the drug. So if we say that a drug has good oral absorption, if the drug ticks all these 5 categories. So a drug is orally absorbed if it has no more than 5 hydrogen bond donors. So what are the hydrogen bond donors? Example, nitrogen or oxygen atom with 1 or more hydrogen atoms. Okay. Next is not more than 10 hydrogen bond acceptors. So 5 hydrogen bond donors and 10 hydrogen bond acceptors like nitrogen or oxygen atoms. Then we talked about the molecular weight. So you all know only drugs with low molecular weight is likely to be absorbed more faster. So molecular weight should be under 500 Daltons so that the drug can be orally absorbed. Next is partition coefficient. The log P should be less than 5. So these are the categories that an oral drug has to tick for knowing that it's a good absorbed drug. Next question, which type of drug cross blood-brain barrier? So blood-brain barrier, not every drug can cross blood-brain barrier, only selectively permeable, it has got a selectively permeable membrane, and only selected drugs can cross the blood-brain barrier. So capillaries in the brain, they are less permeable to water-soluble drugs and more permeable to lipid-soluble drugs. So before going into this, I'll tell you, so any drug, in order to get absorbed or in order to cross the blood-brain barrier, or cell membrane, it needs to be lipid-soluble drug. It is also known as lipophilic drugs. So what is lipophilic? Lipophilic means lipid-loving drugs. So the drugs that are lipid-soluble can cross the membrane easily. But what about the drugs that are water-soluble or lipid-hating drugs? These are known as hydrophilic drugs or water-loving drugs. So where is the water mostly seen? In your urine, okay? So just imagine it like that. So a drug needs to get absorbed. It has to be in the systemic circulation. It has to go to different parts of your body where your lipid layer, it has to pass through the lipid membrane and all. Okay? So only the lipid-loving drugs can do that. But water-loving drugs needs water. So just imagine urine, okay? So urine is part of excretion, kidney excretion. So the drug gets excreted fast if it is in the hydrophilic form or if it's a hydrophilic drug. Okay, so just that was just a brief. Coming back, so as I told you, the lipid soluble drugs cross the blood-brain barrier because the capillaries in the brain are more permeable to such soluble drugs. Examples are thiopental and levodopa. So you all know what dopamine is. Dopamine is given or dopamine is something that is needed for Parkinson patients. Because the dopamine level is low, the Parkinson patient has got such problems. So what we give, the drug of choice is levodopa. Why are we not giving dopamine just like that? Okay. So you all know what Parkinson disease is. In Parkinson disease, the dopamine level is too much decreased. So that's why we use levodopa, which is the drug of choice for Parkinson disease. So why are we not giving dopamine directly to the Parkinson patient? Why are we giving us levodopa? It is because dopamine cannot cross the blood-brain barrier. It is not lipid soluble, and exactly why we are not giving dopamine directly into your brain, because it is not lipid soluble. It cannot cross the membrane. That's why we give levodopa, because levodopa can cross the membrane, and after it crosses, it can convert itself to dopamine and do its action. So thiopental, levodopa are examples of lipid soluble drugs that can cross blood-brain barrier. So what are the characteristics that favor the crossing of blood-brain barrier? One is high lipophilicity, okay, as we discussed, high lipophilicity or lipid-loving drugs, okay. So the opposite, less hydrophilic drug, that is, drug that does not like water so much tends to go into the lipid membrane or lipid areas. So high lipophilicity, low hydrophilicity, small size and molecular weight. Of course, only molecular weight and small size drugs can cross it easily. And low hydrogen bonding potential, that is, the drug is unionized at physiological pH. So as I told you, lipophilic drugs can get absorbed easily or can cross the membrane. Same way, unionized drug can get absorbed and can cross the membrane easily. So what happens when a drug is ionized? If a drug is ionized, what happens? It gets out of your body fast. But as long as the drug is unionized, it can stay in your body. It can get absorbed. Where this ionization happens mostly? It is the part of the metabolism. A drug, it will turn from unionized to ionized and gets out. That's why in order to get the drug out of your body, the process happens. So a drug which is unionized can get absorbed easily and can cross the blood-brain barrier. Now let's look into half-life of the drugs and the factors that affects the half-life of the drug. So what is half-life? The time required for the drug to become half of its original concentration. That is half-life of the drug. Okay. So half-life is secondary parameter that depends upon the primary parameter, which is clearance, apparent volume of distribution. Half-life is related to elimination rate constant also. So the factors that affects half-life is clearance, apparent volume of distribution, elimination rate constant. Okay. The factors are volume of distribution, plasma protein binding, clearance, kinetics, presence of secondary drug, disease, active metabolites, enterohepatic circulation and hepatic blood flow. These are all factors that affects the half-life. So you all know, if the half-life is prolonged for a drug, it means that the drug can stay in the body for longer period. If the half-life of a drug is too small, what happens? It gets eliminated faster and we'll need to give additional doses for that drug. Okay, I hope you understood. Half-life, as long as it is increased, it means that the drug can stay inside the body for long. So in case of some drugs like tedium drugs and all, if the half-life is increased, what happens? It will stay in the body and it can cause toxicity. Because the half-life is too long, it can cause toxicity. So for example, like a drug like fluoxetine. Fluoxetine is an antidepressant. It has a half-life of about 14 days. So these are the factors that affects the half-life. So as you all know, if a drug's half-life is long, it means that it stays in the body for long. If the half-life of the drug is low, it means that it gets out of the body fast and you need multiple administration of the drugs. Next is bioavailability. Bioavailability is the rate and extent of absorption of unchanged drug from its dosage form. That means how much drug is available in the systemic circulation after absorption. That is bioavailability. The rate and extent or the amount of the absorption of unchanged drug from its dosage form. How much drug is available for absorption. That is bioavailability. As you can see, this is the graph that represents bioavailability of each drug. For as you can see, we have in x-axis the time and in y-axis we have the plasma concentration. And there are different colors. The blue color represents the oral drug, green the intramuscular drug, and red IV drug. As you can see, the IV drug has the highest bioavailability. Why is this? It's because it does not undergo absorption. IV is directly, intravenously, you're giving the drug into your blood circulation. So where the drug has to get absorbed? Into the blood circulation, right? So if you're giving a drug directly into the blood circulation, there's nowhere the drug can get wasted or can, the whole drug as itself is getting into your systemic circulation. So we are deleting the absorption part when it comes to intravenous route, which is we're directly jumping into distribution. All of you know about the ADME, absorption, distribution, metabolism and elimination. In that, for intravenous drug, we don't see the absorption. Why? Because we're directly getting into the distribution phase, because directly we're giving the drug into the systemic circulation. That is why it is 100% bioavailable. That's why the graph is the highest for intravenous. Next highest is the intramuscular. So it is not directly given into your blood circulation, it is given into your muscles, okay? But still it is not going into your stomach. It is given to your muscles, and from the muscle it needs to go into the blood circulation. So compared to the IV, IM route is not 100% bioavailable, but still it is more bioavailable than oral route. Oral route has got the least bioavailability compared to the three. As you can see, the slope is less. This is because it has to undergo absorption. It has to undergo ADME, absorption, and then only it can undergo systemic circulation, or then only it can start the distribution.